Last week, convicted felon Donald Trump nominated wellness influencer Casey Means to be our next Surgeon General, saying that RFK Jr. had told him she was, quote, fantastic. Here to talk about what this means for America's healthcare system is Executive Director of the Committee to Protect Healthcare and an emergency room doctor himself in the great state of Michigan, Rob Davidson. Dr. Davidson, thanks so much for being here.
Happy to be here. Sorry, it's under these circumstances.
I know, I get that a lot.
Yeah.
Um, so you've been very public about your opposition to people like RFK Jr. So I'm going to take a wild shot in the dark that you don't think Trump's nomination of an RFK ally with no public health or government experience to be Surgeon General is some kind of genius move.
Yeah. I mean, the 4D chess we've all been told about over the past 10 odd years. I guess some might think that's at play, but I don't see any sense in Casey Means being the Surgeon General. It's just, it doesn't fit with what I've always known to be a Surgeon General since I was a teenager. And C. Everett Koop was the face of anti-smoking, the face of AIDS public education in a time of turmoil regarding the AIDS epidemic. That's how I grew up, knowing what a Surgeon General was, to Vivek Murthy talking about gun violence as a public health crisis and loneliness and depression and mental health. Casey Means talking about good energy and bad energy and sweat lodges and singing to the trees just doesn't fit in that model of what I always thought it should be.
Well, I'm sorry you're so close-minded, sir.
Oh yeah, very yeah,
Uh,
right. I know. I mean, I've been a doctor coming up on about half of my life. I've been a physician, and
uh,
sometimes we get a little narrow-minded in how we look at the world. But I'm an ER doc. Like, I see everything on a regular basis. I worked last night till about midnight or so, and runs the gamut of patients and their presentations and their lifestyle choices and their kind of, just, we talked about it, like the world in which people live that typically come into ERs, like. I think all of us should be concerned, whatever our political persuasion,
yeah.
to corrupt the public health infrastructure the way they have and the way they're continuing to do so with this pick with Casey Means. It's mind-boggling. It's very frustrating, very distressing for me, and it should be for everyone.
God, there's so much I want to unpack here. RFK Jr. pretty famously embraces bad science, otherwise known as not science, and also, is a believer in absolutely whack job medical conspiracy theories. Is the same true for Dr. Means?
Well, it appears to be right now. I know there's been criticism that, well, she didn't finish her residency, so there's a problem. Hey, listen, I mean, she went to med school. She is a doctor. We should call her that. And she
Mhm.
decided she didn't want to do that at some point. I think 4 some odd years into a surgical residency. That's fine. I know really good people who decided this wasn't for them. Most of us decide around age 18 or 19 to track into pre-med, and about your mid-20s. I mean, how many people from the age of 18 to their mid-20s or into their 30s are exactly on the same path? That's pretty
Sure.
rare. So I got no problem with that. It's just she left medicine to go and be an influencer, to write books, to sell products, to sell supplements that are untested. She and her brother wrote a book on health and wellness based on good energy and bad energy. She has rejected oral contraception as a good concept, saying it, creates infertility, which it does not. It's been refuted by every study, every major organization that deals with women's health. So to decide not to be a doctor, that's fine. To then go off and sell books and supplements, well, there you're starting to make me a little concerned. But I guess, hey,
Yeah.
it's a free country. You be an entrepreneur, you make your money. So then take that to being the public health mouthpiece and figurehead of this administration and of this country. Like, that's too far to me, and that's my big problem. Like, she can do whatever she wants in the private sector. I may object to it, I may not agree with it, and I may warn people against it. But boy, when she brings it to this stage, that's a real problem. I think we should all be speaking out, and hopefully can create enough pressure to sideline her and get someone in there who at least believes in basic science.
Right. So I want to ask you, and you've sort of been talking about this, how much power and influence does a Surgeon General have? And as you said, I'm old enough that back in the day, C. Everett Koop was everywhere, and he had that very distinctive look, and everybody knows about the warning on cigarette packs.
Yeah.
Um, but what kind of platform really will Means have if she's confirmed? What exactly does the Surgeon General do on it all day?
Yeah, I mean, like technically they're the head of the U.S. Public Health Service Corps, but like in a real sense, they're just like the chief communicator about healthcare and public health for the administration, for all of HHS, for all of the government, and really, I mean, as a physician, they are for us, right? Hopefully, the mouthpiece of all of us practicing medicine, so that we have conversations day by day with our patients on a one-on-one basis, and despite what this administration's doing, we still do that. We still practice good medicine in large part, but they have that platform that they can take the things we're talking to our patients about every day, ostensibly talking about smoking cessation, talking about, the importance of vaccines, right? We
Right.
hope that, and we have always expected that, and they have always done that. That they're out there communicating that in a bigger way. See Ever Coop, I mean, I just think of him with the bow tie and the beard, but
Yep.
in a time of AIDS as a moral dilemma, and in the Reagan administration sort of not wanting to discuss AIDS other than the moral aspect of, gay people and drug users getting AIDS, the Ever Coop came out with a publication in '86 saying, no, that this is a public health issue we all need to be concerned about. He talked about the actual science of how AIDS is transmitted and HIV. They sent a booklet to every household in the United States in 1988 explaining what AIDS is, how you
Yeah.
get it, how you don't get it. I remember like the days of people being afraid to shake hands with somebody with AIDS, that you might catch AIDS, right?
Oh,
Thinking
yeah.
it's something like Ebola. And he helped dispel, despite the fact that he was, a moral, sort of conservative, religiously conservative
Right.
individual. He put that aside. He said, no, no, this is about public health and science. This is how we should be communicating. Appreciate that, although I might not have agreed with his politics. I don't see that coming out of RFK Jr. for certain, based on his testimony, based on all of his actions thus far, based on his career of profiting off anti-vax rhetoric. And I certainly don't see that happening with Dr. Means. That should be a red flag to all of us.
Yeah, and an article in the Atlantic last week written by Nicholas Florco said that should means be confirmed, this would sort of complete a MAHA, Make America Healthy Again, makeover of our federal health agencies. Yeah, Florco wrote that in addition to RFK Jr., she would join National Institutes of Health Director Jay Bhattacharya and the new FDA commissioner. Is that true? Is this basically, they've run the table on this right now?
Yeah, and I hate that they get to take on that moniker of "Make America
I
Healthy
know.
Again," right?
I know. I
Because
hate
some of
saying
the
it.
things, a lot of the things they talk about make complete sense. You can't argue with the fact that people should be getting out more in the world, getting more sunlight, touching
Sure.
grass more, should get exercise. People should eat better, right? And so it's hard. I can't argue with any of that. And we talk to our patients about that all the time. My wife's a
Sure.
family doc. I just went to see my family doctor this morning, and we talked about, hey, are you getting enough exercise? How's your diet? Are you drinking too much alcohol? And hopefully, in helping promote healthy practices, we have done that for years. We all agree with that. The problem is they've thrown their lot in with an administration and, frankly, a party in the Republican Party that hasn't supported infrastructure that promotes those lifestyles, right? They haven't supported, getting rid of food deserts in some communities, creating more green spaces, right? More public transportation so people aren't driving everywhere and they can rely on their feet to get them places, to get to the train or what have you. It doesn't hold water because they go from that step to then saying, well, these things are poison. These vaccines we know save lives. We want to exclude all other basis of medicine and science
Right.
except, exercise and yoga and all that. Someone that saw just a couple of days ago having a heart attack, it doesn't do much good for us to kind of, sing to the trees and wish away the bad humors when they just need a balloon in their artery to open up their artery and prevent them from dying. I mean, so we can have it both ways. They don't seem to want to do that. They want to just pursue this pure non-evidence-based practice. It's really damaging to folks. And yeah, it seems that with her, the takeover would be complete. And I guess it's going to take some time to roll that back once we get control back.
Well, that's actually a question I want to ask you later. But before I get
Yeah.
to that, I want to talk about RFK Jr. himself and specifically some things he said at a House budget meeting on Wednesday. First, he said that if he had kids, he would, quote unquote, probably have them vaccinated for measles. Then he said, I think if I answer that question directly, it will seem like I'm giving advice to other people, and I don't want to be doing that. Now, feel free to tell me I'm crazy, and you wouldn't be the first doctor to do so. But isn't part of being the head of the Department of Health and Human Services supposed to be giving health advice to Americans?
Absolutely, right? It's part of the purpose, right? Besides administering and overseeing like the government programs that fund people's healthcare, like Medicare and Medicaid, and obviously they're trying to destroy all of that. But yeah, like a primary component is the head of the public health apparatus of this country. They should be giving medical advice. That advice should be get your kids vaccinated for measles, not I probably would, or I don't want to say I would because people might listen to that. You know what?
Right.
Say you would. People might listen to that. I do that. We all do that. I do that with patients. Would you do this? Yes, I would do this. Would you choose this therapy that has a lot of risk, maybe little benefit? No, I would not do that. It is available. Here's the data behind it. You want to know what I do? Here, what I would do. We all do that. We should. He should be doing that. The problem is the beliefs that he holds, or at least the ones he's espoused in his private life, profiting off anti-vax, are actually detrimental to people's health. So he's right. People should not listen to him specifically.
Right.
They
Right.
should be able to listen to the Secretary of HHS for medical advice. He sort of proved our point and has disqualified himself in a very short. I saw a 4-second clip, and right there was the ball game.
Yeah.
He gave it up.
Yeah, he said, I didn't quote this part, but he said something like, people should not be coming to me for medical
Yeah.
advice. And I was like,
That's the
yeah,
4-second clip. He's right.
yeah,
Yeah.
okay.
Amen.
Yeah, yeah,
Yeah.
absolutely. So I want to get back to something you referenced a little earlier. Obviously, in the short term, these people are very, very bad for our public health system. And as far as I'm concerned, they will undoubtedly be responsible for preventable deaths, some easily preventable. How much long-term damage do you think they'll do? Let's say best case scenario, there is an election in 2028, a Democrat wins. Will it be fairly quick and easy to undo everything these people are doing and will do? Or will the havoc that they are wreaking take a long time to recover from?
First, your premise of a Democrat wins, like I agree that that is the most likely way to get back to normalcy. But let's be real, like John McCain, President Romney, they would not have done this to
Of course not. Of
HHS,
course not.
right?
Right.
So I mean, I think this is such a weird time. But yeah, so let's suppose the whole apparatus goes back to sort of maybe not business as usual, because business as usual has not always served people in the absolute best way. That's for sure. We have a lot of work we can do. But
Sure.
it goes back to like evidence-based, science-based medicine. Like this could be a generational type of effort that we need to undertake to get us back on the rails. Because, you know, I mean, it didn't just start with COVID, but it was accelerated during COVID with social media and with sort of influencers coming out, against the vaccine, against kind of common sense measures to prevent the spread, telling people it wasn't a big deal when we were seeing people literally dying, kind of barely staggering into the ERs all over this country.
Yeah.
That started it, and this is pouring fuel on the fire and fanning the flames by then handing over the people who are the perpetrators of all of that and letting them be the mouthpieces, the messengers for public health. They're what started as a fringe and kind of grew into somewhat of a partisan divide about their kind of support of public health. They're now risking taking that into the more mainstream, it bleeding into folks who wouldn't have a partisan allegiance to pick sides on vaccines or not, or public health or not, but just are trying to get the best evidence they can.
Right.
We can only do so much patient by patient in educating those folks. Yeah, so I think, a generation maybe, right? 10
Wow.
years, 20 years, something like that. I think it's going to be a lot of work, but I mean, we can do it, but we can't let this go on too long, or they could
Yeah.
cement that as the reality of what public health is in this country.
And am I being hyperbolic when I say that I believe that these people will undoubtedly be responsible for preventable deaths?
Oh, no, no. We see evidence of that in the measles outbreak, right?
Yeah.
Um, you know, being opposed to and espousing views on the MMR vaccine that are untrue, right? Claiming they're connected to autism, untrue, claiming there's danger in them, claiming they don't have lifelong immunity. They have one of the most lasting immunities, the measles vaccine, of anything we've ever seen. Claiming all of that and convincing families not to vaccinate their kids, and then even just having 2 kids now die of that, those are preventable deaths. Those are on the hands of
Yeah.
folks like RFK Jr. and that whole movement. And yeah, if they continue to do that and more people go down that path and these outbreaks get worse, there will undoubtedly be more deaths.
Something I'm really curious about is what you think is sort of their end game here. Like, why are they so bent on destroying our public health system? It's very easy to sit here and say they want us to die. And there are a lot of times when I just believe it's that simple. They want us to die. They don't care if people die. But then I'm like, you know what? It can't be that easy. I mean, do they really believe all the debunked studies they cite, all the insane conspiracy theories they spout, and they honestly think they're doing what's best for America?
I mean, I think figuring out their motive is always a challenge, right? I think there's probably 2 options if we can split it into 2 options. One is that they're just don't know what they're talking about, and they've
Right.
clung to ideas that simplify very complex systems and very complex realities. And because they don't know any better, they don't have the proper training, um, that they just that's the views they push. I think the more nefarious side is that this is the long game, the short game and the long game grift for so many of these people.
Yeah.
Casey and Callie Means, her brother Callie, writing a book, selling wearables for promoting health, selling supplements that are unfounded. RFK Jr. suing for because of the MMR vaccine. I think he has a lawsuit still active, or maybe he's now said that anything from that will go to his heirs. I forget the details, but suing the makers of Gardasil, right? That is a vaccine against HPV, a vaccine that is actually shown to prevent cancer, right?
Yeah.
So like the grift is heavy with these folks. And I would suggest that for a significant number of the leaders of this whole movement, that's the end game, right? Making more money. The unfortunate thing is the people who get caught up in it, who just don't know any better. They're not dumb people. They're not even maybe gullible people. They're people looking for answers outside of, the complexity that they've been told that maybe doesn't answer all the questions. I can't tell you how many times people come in with a complaint and we tell them, listen, we don't know. We've ruled out a lot of bad things and that's our
Right.
job. We don't have a good answer. Hopefully we can get to that eventually. Follow up with your doc, follow up with the specialist, what have you. I'm sure that is frustrating for quite a few people. And for things like autism, for parents to hear, listen, we don't know exactly what this is. We know the things it isn't, but there's probably some combination of genetics and environment and, the in utero environment of the time of year that you were pregnant and illnesses you had, things that you just can't absolutely hang your hat on and say, this is it, here's the cure.
Right.
It's gotta be frustrating, and so they cling to folks like RFK and Casey Means who tell them things that are more simple, and they can find a boogeyman, an answer, a reason why this is happening to them and their families. It's really sad because they're preying on people who are very vulnerable, and then, the rest of us get caught up in it when they get hold of the reins of power.
Yeah. Look, I only have a minute left, but I want to ask you a question. I want to sort of shift tacks a little bit and ask you a question because I think it's really important. And you're on the ground. You are an ER doc in Michigan. Can you talk about how the potential cuts to Medicaid that Trump's GOP is pushing will affect the states, will affect the things that you do on a daily basis?
Yeah, absolutely. I work in a poor rural community, and it isn't just poor rural community, but it will specifically affect our community more than anywhere else. People on Medicaid, I've heard a lot of talk about, well, we're only going to cut it for people who don't deserve it, or we're not going to let the vulnerable people lose their Medicaid. The
Right.
reality is, if you get diagnosed with cancer, if you have even appendicitis, you're vulnerable. And if you are just living on the edge, right around the poverty level, that is not a way people can really thrive in the society. And if a medical bill that you can afford pops up, or if a condition or a symptom pops up where if I go in, I'm going to get a bill, you're not going to go in, right? You're going to die from that, or you're going to end up bankrupt, or we're going to have more GoFundMe's for people for medical care. But the other thing it'll do in my community is it will threaten the health of everybody in the community. our community hospital will not survive with significant cuts to Medicaid. The
Mm,
primary care offices in the community will not survive, right? The x-ray suites, the labs, they can't survive without the, third of patients or so that are on Medicaid that come in and have, payment for the services that are rendered. And so people with private insurance, people with Medicare, people with workplace insurance or ACA insurance, they're going to suffer too, because those facilities will just go away. And
right.
now when you're having chest pain or you have trauma or you're having a stroke, it's going to be an hour instead of 10 minutes to get where you need to go to get, that stabilizing care that can save people's lives. That's one thing I think isn't being talked about enough
Yeah,
and is
sure.
really critical. We see hospital closures already. A friend of mine in Delaware County in Pennsylvania just had his hospital closed because the private equity bought it and then they couldn't make enough profit, so they decided to close it
Ugh,
up, right? That's another crisis that needs to be fixed.
yeah.
But, to have a self-inflicted wound of our own government doing it to these communities because they want to pass a tax cut for billionaires, like that is should be a crime. And we'll see it and we're fighting it, right? Our organization's fighting it. We are on the ground fighting it and telling the story so people know how critical these programs are and how we really can't cut them and really should be expanding them.
Well, Doc, I really appreciate you coming on, and I really appreciate the work you do both as a doctor and as the executive director of the Committee to Protect Healthcare. Thank you so much. It was great talking to you.
Same here. Thanks again. And thank you for being out there on the front line, spreading the word. I think this is critically important. Thanks.